Hello, good evening everyone. This is DMA's FMGE Hacks, and today we are going to talk about the surgery. And speaking about the surgery, we are having this high yield area here. So speaking about the surgery, there are four things you have to master in surgery. One is your GA surgery, another one is your hepatobiliary system, and another one is your urology, and then you have your CTVS, that is cardiothoracic and vascular surgery. So these are the four areas you have to master, and apart from that, general principles is a middle area where you have to expect this questions from. So GI, hepatobiliary, urology, CTVS, and general principles are the four areas. A general principle includes the trauma, are the five areas where you can able to get most of the surgery questions from. So as per the analysis from the previous year questions, you have had the highest area is so called as your GA surgery, and after the GA surgery, your vascular surgery and the genitourinary surgery are the areas where we have seen most of the questions from. So speaking about here, we discussed the surgery in seven aspects based on the general surgery, gastrointestinal, CTBS, urology, orthopedics, neurosurgery, and surgical specialties. We divide this into these following region. So in the very first thing is your general surgery. Speaking about the general surgery you have to know about the surgical instruments and their uses, and then all the suturing techniques you have to know. And then there are certain management of the surgical emergencies like appendicitis, bowel perforation, and so on. And then you have the surgical management of trauma. Trauma is one of the topic of interest people all the time. So speaking about this trauma, speaking about the trauma, you may have to remember this, the primary survey and the secondary survey, and then the organs affected during the blunt trauma, the GA tract, and other area of your blunt wound and the stabbing wound, and you have to identify the differences, and then you have to remember all the EDH, SDH, and all those things, and then management of airway, circulation, and breathing. Yeah, shock index. So trauma is always be considered as one of the effective topic that you should not miss. So speaking about that trauma, so trauma is one of the high yield area people where you have to remember. And the most common area they may ask you is your GCS score. They give you the GCS score, and then they will ask you to analyze what score the person possess, or that the patient possess. And apart from that, you have principles of anesthesia and surgery are the areas you have to talk about the general principles of your surgery. Then now the next area is so called as your gastrointestinal surgery. Speaking about the GA surgery, the very important area is your hernias. So you may always expect a question from the hernias, and apart from that, you may have the treatment of gallstones, and then you have to talk about the gastric ulcers and the perforations. So IBD, PUD, and hernia, IBD, PUD, hernia, malrotation of gut, appendicitis, and fistula, anal fistula are the topic of interest in terms of your GA surgery. Even if you don't read the other things, these areas you have to master, people. These areas you have to master and the GA surgery. So IBD, peptic ulcer disease, hernia, malrotation of gut, and appendicitis and fistulas you have to remember in terms of GA surgery. In terms of your cardiothoracic, and speaking about the cardiothoracic, you have the CPR, and then you have the cardiac catheterization and angiography, and the CABG, and thoracic surgery for your lung cancer, and heart and lung transplantation. So these are the topic of interest this may have ask you. And apart from that, in the case of your vascular surgery is another important one. So vascular surgery, DVT, and varicose vein are the two important topics where you may expect a lot of questions from. Varicose vein and DVT that you should not miss. And then you have this urology. Speaking of a urology, so kidney stones and their procedure, kidney stones and their procedure, TURP, and then you have this TURP and BPH. Speaking about the TURP and BPH or prostatic area, and then you have this urological emergencies like urinary retention, renal pain, colic pain, And apart from that, surgical treatment of bladder cancer and renal transplantation of the area, you have to focus. The main area of interest should always be the RCC and the tumors of your kidney, tumors of your urology, I rather write tumors of urology, and then stones, and then you have this BPH and TURP of the high yield areas where you have to focus on the urology. Okay, then the next area of interest is your orthopedics. So all the casting technique and closed reduction techniques, joint replacement surgery, spinal fusion procedures, and management of fractures in different anatomical region and arthroscopic procedures for the joint conditions are the areas where you should not miss. All the named fractures, we will discuss that in the orthopedic section. And you know, the named the tumors of your bone, tumors of bone, and their x-ray findings are pretty important. Their x-ray findings are pretty important, you should not miss it. And apart from that, you have any arthroscopic procedures and then replacement surgery are the areas where you may expect to see the questions from. And then you have this neurosurgery. Speaking about the neurosurgery, craniotomy and craniectomy, and brain tumor surgical removal and management of head injury and ICH, and then shunt procedure for your hydrocephalus comes under the category of neurosurgery. These are the basics that you have to know, people. The basics that you have to know. And apart from that, you have the surgical specialties. The important surgeries you have to remember is the cleft repair and the cleft palate repair, cataract surgery, C-section, and pediatric surgical procedures like appendectomy and herniectomy, etc. So speaking about the surgery now, you have to remember GIT, hepatobiliary, GIT, hepatobiliary, urology, CTVS, cardiothoracic and vascular surgery, that is CTVS. And then you have to remember general principles including trauma. These are the areas where you have to master. In the G8, you have to remember what are the diseases I've told you. In the hepatobiliary, all the lobes of liver and their hepatectomy, right hepatectomy, left hepatectomy, extended right hepatectomy and extended left hepatectomy, and then you know liver cyst, and then hepatocellular carcinoma, the named classification, acute pancreatitis, cholecystitis, all of them are pretty important in terms of your hepatobiliary. Urology, as I told you, RCC, TURP and stones are the primary focus of area, and the CTVS, varicose vein, DVT and CABG are the primary focus of area. And the general principles, trauma, shock are the primary focus of your area. So with this, we are completing your surgery, and thank you everybody, and we will see you in another subject.